Welcome to this episode of Eureka. In this COVID special, we have a very special guest for you, Dr. Rohit Sarin. You are the former director of National Institute of TB and Respiratory Disease, and he is a member of National Task Force on COVID of Government of India. As we are aware, the pandemic is ravaging all through the country. It's an important challenge for the medical professionals, administrators, and other government functionaries, as well as common public. We also have a very important role to play. We need to practice some of the hygiene measures, which are advised by the public health officials. In today's episode, as he is an expert on respiratory disease and also a member of a National Task Force, we are going to interact with him on a number of very important issues. And thank you, sir, for being with us in this episode. It's been a very great opportunity. You have led a very important institute in this country in a fight against tuberculosis, one of the another major disease, which many people may not realize, but it's a very important area to address in the medical challenge of India. Today we will talk more about COVID, but of course also we need to talk about tuberculosis because it's also another respiratory disease. Sir, let me start with this question. COVID is also a respiratory disease. I mean, it's a virus which affects our respiratory system. So what does it do? I mean, how does it enter our body? What does it do to our respiratory system?
I think it's important to understand that this particular virus infection comes through droplets. That means any person who is already having this particular infection, when that individual is going to cough or sneeze in an unprotected way, then these droplets get inhaled by the unsuspected people in the vicinity. Okay. And especially if the distance is less, I think the chances of an individual inhaling these droplets becomes much more.
Okay.
When it enters into the lung, it causes a number of reactions which take place. And it also affects other mucous membranes down the passage. That means starting from the nose onwards to your posterior part of the throat, which we call as the pharynx, and then we move down, you see, into the trachea and then the lungs. So all these passages get inflamed, and one gets, so to say, the symptoms which we attribute to this particular infection, like cough is there, and we also get sneezing and rhinitis and something like a common flu sometimes you see one may have experienced. So all those things start happening, and if you see the body's immune system is decreased to some extent because of any other comorbid situation, then definitely the impact of this infection leading on to the disease in the individual becomes much more severe. And there are different stages in this, and to start off, it starts with more of the virus entering into your body and multiplying, which we call as a stage of viremia. And this virus is in huge numbers. At the same time, you see the symptoms like constitutional symptoms of fever and headache and body aches. You see, these start occurring. And there is a stage of inflammation in the body which starts. And in this inflammatory stage, that one starts getting, you see, more of the lung inflammation. And one gets this lung inflammation, then obviously the breathing gets affected, the coughing becomes more severe, and you see, sometimes one feels that, okay, after this phase is over, maybe we are secure, maybe we are happy, but really that's not so, because your own body system, your own immunology is such that it brings about a thromboembolic phenomena. That means there is some clotting which happens in different parts of the body system. And again, you see, can happen anywhere from you see the second week onwards to the fourth week till that, one can have all those things. And when that happens, then your brain gets affected with the thrombus, your heart may get affected. And, we have seen sudden deaths happening. You will find that, okay, the individual was all right in the initial phase, he's passed through. But then about 10 days down the line, he is landed up in the critical care unit, ICU and all. So, it's not a very simple thing. It's a very complex sort of a situation. But I have put it more simply so that everyone understands what is.
One question many people have is that, and also many people actually believe that one is unnecessarily scared of novel coronavirus or this COVID disease, because after all, respiratory diseases are very common. I mean, almost every season, everybody gets a cold. Once in a while, you get a flu. So why should we so much scared about a respiratory disease? It's after all very, very common phenomena. I mean, common experience, common ailment. How the COVID is different from other kinds of, let's say, cold or flu kind of respiratory diseases?
I think one thing which is important here when you are talking of fear, well, I would say that there should be no panic reaction.
Okay.
In a way, what you say is correct, that it is a virus infection, and there are so many other viral infections. Why are we so much concerned about this specific viral infection? One thing is that it is new. So when it came up, we were not really aware as to what all damage it could do. So everyone was very scared. And now today, when I talk of, these stages of viremia and, inflammation and then thrombo, we did not know all that.
Okay.
We are wiser, and therefore I can say that there is no need to get unduly scared about this particular infection, right? Having said that, I will say that the chances of death are more if an individual, is having a pre-existing other illness, say some cardiac illness, hypertension, diabetes, COPD, other lung, chronic diseases. So in that context, the damage caused by this virus is much more, and chances of death may happen.
Okay.
Even if the percentage-wise the deaths are may seem very less when we say okay 1% or 2% may land up in the ICU, but in numbers that becomes huge. So therefore it needs to be tackled effectively, and one has to understand that the moment you start going downhill, you have to be very careful in terms of seeking medical help. One should not be negligent and waste time in this.
Right? Very, very, very important point that you said, that we need not be unduly scared about this disease or panic about this disease. But of course, we need to be cautious because the disease is life-threatening in some cases. So we need to be careful, and we should follow the hygienic advice. That's an important point. Let me ask you one more question. That when the virus attacked India, the pandemic started to spread in India, we had to undergo lockdown. I mean, that was one way we can buy time by the time that we can prepare our medical facilities and other facilities to slow down the spread. And indeed, we have been able to some extent slow down the disease. I mean, that's very clear, because one can see that the initial time the spread was much less. The question that comes is, many people are saying that because we had closed number of medical facilities during that lockdown, which was essential, other diseases, taking care of other diseases have been also hit. Like, for example, the institute where you are the head, one of its major task force looking at tuberculosis. So many other diseases which were ravaging India and ravages poor perhaps got slightly neglected or were not taken with priority. So how do you see that now that we are unlocking? How do you see that we should balance it so that we are able to tackle COVID and also the diseases which are troubling us otherwise?
I think you touched a very important issue, because after all, the resources within the government system are limited. And then if we harness even the private system, still you see the total resources available for handling this sort of a crisis were limited. When we talk of, I've just talked about mortality, that means we needed to enhance our strength of ICUs, we needed to enhance ventilators. We really did not have all that in position at the very outset. And therefore we needed a lockdown so that medical preparedness would be there to handle, whenever the spread of this particular infection happens. The spread is going to happen, is happening, and will continue. So that is something which, we all are aware. But somewhere down the line, we should also be very much concerned about the fact that what about the other illnesses? And are we focusing on them, illnesses which have been there with us for decades? We have national programs for those illnesses like tuberculosis. I mean, are we neglecting something like that and, having just one focus in one direction? Well, to some extent, yes, these national programs have got affected. See, and the reasons is not just that health systems, have changed focus onto COVID, but overall the infrastructure is more inclined towards reprioritization towards this infection. Say, for example, now transport systems, they got affected, they got impacted. So the people seeking access to healthcare services, that access issue was also an important component. The people who were having, symptoms of diseases like TB, they could not approach the health system. So our number of cases diagnosed reduced. Not only that, you see, some of our health personnel who are involved directly into TB care, like laboratory technicians for detecting the TB germ, they were, focused more onto COVID detection. And these technicians obviously then were not able to detect that many TB patients. And therefore we find that the notifications of tuberculosis disease, in fact, have come down considerably. That doesn't mean the disease is not there. The moment we have to refocus on TB, one would find that, your disease will come back with a vengeance. Because transmission of TB is happening because the individuals who are having the disease are not getting the treatment they should, and they are spreading this disease, amongst the society where they live. So I would say that the infection has damaged society in many ways. We have seen it. Health is one component. Economic, damage is another component. Other programs, other diseases, that is another component. So the damage is not just limited to, the infection by the virus.
So it's a major challenge, and we had to wade through it. Perhaps there's a time that we should, when the unlock is happening, that we should also restart focusing on the issues which are at hand. Sir, we'll take a very short break. After the break, we'll continue this conversation. Keep watching Eureka. We'll take a very short break. After the break, we'll also discuss about the National Task Force on COVID and also vaccine and issues related to it. Keep watching Eureka. After the break, we'll continue this conversation. Welcome back to Eureka. We were having a very wonderful conversation with Dr. Rohit Sarin. He was the former director of National Institute of TB and Respiratory Disease and currently a member of National Task Force on COVID. Sir, before the break, we were talking about how as a respiratory disease, COVID was a new challenge. And also because of this new challenge that came out of the blue, that we were shocked, awed, and then we had to divert our resources to it. And because of that, many other diseases got neglected, and we are restarting to balance our approach to addressing these diseases. One question that I would like to ask is about this National Task Force on COVID. What is it? Can you give us a brief overview on that?
You see, the thing is, it is an effort by the country to get a team of experts who are not only dealing with certain infections, but who are also into, laboratory, into research, into virology, and clinicians. And all these experts, the country has nominated so that we are able to share our views, ideas, and bring out certain guidance for professionals. As I said, that this is something which was new, and we really did not know much about this particular infection.
Okay.
And that was the reason why we needed to have a task force at the national level. And involvement was by none other than, the chair of the national task force is the health chair for the Niti Aayog. So you can understand the importance that this task force has, and the work at hand which it has. From the highest office in the country, we are getting support for this. And this task force deliberates on different components. That means what is this infection, how to go about managing this at different levels, at different facilities, what should be the government strategy for this. I mean, all those things, as I said, we really did not know. Should we isolate? Where should we isolate? How much should we isolate? For how many days the individual should be away from work? No one knew about it when we started this whole process. And I will say that down the line, we ourselves have also developed. You see, we ourselves have also learned. The virus has taught us many things. Certain things will be useful, certain things will not be useful. You see, certain drugs which had a lot of hype and all that in the media also, that wow, we found a drug for treating this particular infection. But ultimately, research proved that it's not really true. So what will have an impact, what will not have an impact, all those things were discussed during the task force, and certain guidelines were then laid down by the task force. But the three things which we are very clear about, and there is no ambiguity in that, is that, well, you have to have cough hygiene. That means you will have to have some sort of a mask, whether it's a cloth mask, whether it is a surgical or medical mask, whatever it is, you will have to have a cover. And if you are a health personnel dealing with these sort of infections and diseases, you will have to have a more sophisticated mask, which we call as the N95 mask. So that was something which was very clear and was laid down by this task force. The second thing was that, you will have to resort to more frequent hand washing. Sanitize your hand, clean your hand, because this particular droplet, as I said, which spreads this infection, sometimes it will happen that this droplet will fall on some surfaces and may inadvertently touch these surfaces. And then when we touch any part of our, say, nasal passage or our eyes with our hands, which are infected, then automatically the virus will go into our system.
This place, I want to ask a small question, clarification. This is something that many people have been also asking. So I thought you should be a good person to answer this. See, when we touch some surface, suppose if a virus comes to our hand, all of us are talking about when you touch your nose or mouth, the virus entering your body. Why the virus cannot enter through your skin? After all, you are touching, right?
Yeah, you're right. You see, God has made our skin a very good and effective barrier. It is not just a simple one layer of cells, but it is a very effective barrier. And over the skin, there is keratin, which we call, one part of that keratin is the nails that we see. But similar type is covering all over the skin. So therefore, for the virus to penetrate through different layers of the skin to enter into your body, it's not possible. However, you see, there are other parts of our body which we call that they have a lining of mucous membrane, which is that is the nose and the mouth, these and the eyes, conjunctiva of the eyes. These are mucous membranes, and these mucous membranes are usually one layer or two layers. That's it, and it becomes much simpler for the virus to enter. And therefore, I think we have to be more cautious about these areas, and hence, don't touch the eye or your nose, even if you touched any surface, without washing or sanitizing your hand effectively.
So before I ask the question, you were explaining how the National Task Force was giving advices about mask and hand washing. Sir, can you continue about some of the important ideas that came from National Task Force? I mean, I stopped you in between. Sorry, you can continue that. Yeah,
that's fine. The third thing, is probably distancing between people. That is another important part, because as I said, that it spreads through these droplets, and these droplets will go from one infected individual to another individual only through the air or the distance between them. And if this distance is large, we usually say, 6 feet. Pradhan Mantri ji ne bhi kaha 2 gaz ki duri, 2 yards distance between individuals. So, that really will not allow the droplet to travel beyond that distance, whether we are talking, whether we are coughing. So that is only one way of protecting. That doesn't mean that that alone will be effective. It's a multi-pronged attack. So you will have to have a mask, you will have to wash your hands regularly, and wash in a way that, all your different parts of the hand get cleaned thoroughly, the crevices between the fingers get cleaned, the nail beds and everything gets cleaned, the hands get washed. So you have to, there is a particular methodology for washing, not just, spend a few seconds and that is hand washing. No, we have to wash it thoroughly so that the virus, if it is hiding in any of our crevices in the hand, that gets removed. And then this particular distancing, physical distancing between people. So these are certain things which are very important. I mean, there is no ambiguity on these parts. Then when I said that there is a stage of inflammation here, so the task force deliberated on that if there is a stage of inflammation, which anti-inflammatory medication would be useful in that stage. And we reached a conclusion that, in this particular stage, maybe you will like to give some steroid or something like that, which will reduce the effect of the inflammation, So, and then of course, as I said, the post-infection sequelae, so to say, when we call the thromboembolic phenomena, which could be really very damaging and could be life-threatening. Now for that, we need to, give something which will prevent that thrombosis from happening. There are some medications which are available, which can liquefy the blood and prevent the clotting in the system. So, these are certain things which the task force guided, that in this stage of the disease, if it is moderate, you will do this, if it is severe, you will do this. But one thing here again is very clear, that we should not make an effort or an attempt to treat at home if the disease is, requiring, say oxygen, or a person is heading towards a moderate to severe illness. Please seek the help of your medical personnel close by. That is something which is very clear.
So basically, task force was very important in formulating the treatment protocol for India, right? I mean, like taking the information that is coming from the research world, from the experience of other countries, putting them together, given the Indian context, how to prepare a treatment protocol so that different stages, different levels of infection, people are given appropriate medical treatment. That was one major thing that came out of the National Task Force. Am I correct? I mean, like, to understand you perfectly?
And you see, I'd just like to add here that, this is not a one-time guidance.
Yeah.
Because researchers globally keep on telling us that, well, this is good, you should do this. This is not so good, avoid this. Things like that. And the task force continually is reviewing and revising its own guidance. You see, what we guided 3 months back is different from what we are talking today. So it's an evolving process even for the task force, and that task force will continue on, as science and research develops. This task force will continue to give guidance for the betterment of the society at large.
Sir, now one important question that comes is vaccine. Very clearly, it is now clear that with the reported cases of reinfection, the herd immunity is not going to be the way, for example, the pandemic can be arrested or stopped. I mean, that's not going to be that easily feasible. So one is certainly expecting vaccines to come. They go through the clinical trials and then be successful. So the question comes is that a country like India, which is a very huge country with 120 crore population, even if a particular vaccine proves to be advisable, how are we going to distribute? I mean, it's not like one day morning. I mean, everyone can just walk to the nearest medical shop and get the vaccine. I mean, that's not going to be the factor. So that's one area where people are looking at how we are going to deal this very important challenge that is going to emerge.
I think this is again a very crucial issue. Developing a vaccine itself is an issue, but then once we have passed that hurdle, the next step is how to deliver what we have got to the doorstep where it is required. Now that you must have heard also that capacity to really produce that vaccine is also not that it will serve the entire population within a short time. It may take more than a year, I would say, even with a good vaccine coming, for the vaccine to reach the masses at large. So it's not going to be simple. So most of the industry is really gearing up to manufacture vaccine even before it has proven to be effective. There are some companies in the anticipation that, okay, we have some evidence that this particular molecule is good, we may start at least manufacturing so that we are able to. So that is production, and that is one part, again, one part of the story. The other part is how to make that vaccine affordable and make it reach the people. That is the other part. Whether the cold chain is maintained, whether you see the numbers who are going to be given that vaccine, whether they are. So in that context, government has a thinking on that. And definitely, to start with, it is going to be a prioritized administration for certain groups. Say health personnel who are dealing with this particular infection, they would come as first priority because they are the soldiers who are really fighting this battle. And we don't want to lose any one of them because that is something which would be the first priority. Next priority would be those who are having any other comorbid situations. I have already told you that these people who are having some comorbid situations like diabetes, asthma, COPD, hypertension, renal disease, these are the individuals who will have greater chance of dying if they get the infection. So definitely then the next priority would be in this particular. Younger adults who are healthy, who are otherwise, they would probably go lower down in the priority. So the government will be, having this sort of a mechanism, ensuring transport, and work is happening on this. Guidance is developing on this, you see. So it's not that we are waiting for the vaccine to come before we start, work on in this direction. No, we have already started developing the policy for moving this vaccine once it is developed to different population groups.
Thank you, sir. It was a very, very wonderful, very enlightening, very informative conversation. Keep watching Eureka. We'll come back with another interesting conversation next week, same time.
Thank you. Thank you, Venkat. It is always a pleasure talking with you, and I'm sure and hopeful that this conversation we've had will reach the masses and be beneficial to them. Thank you so much. Thank you, everyone, for listening.